Hello, and welcome back to my IBS site. This is Dr. Scott, and let's continue with part one of why you may still have IBS symptoms. Not seeing a doctor trained in functional medicine. Our current healthcare system is based on a diagnosis. A diagnosis is a group of symptoms that are given a name. And IBS is a diagnosis of exclusion, which means that if they can't find anything else going on, they kind of give it the diagnosis of IBS. They classify it as IBS. Another problem with this model is that each diagnosis has its own particular treatment. So in other words, you're treating the diagnosis, not necessarily the person. In the functional medicine approach, we look at the function, not just the disease. I can have 6 different patients come in with IBS type symptoms, and they can have 6 totally different treatments, or 6 totally different causes of those symptoms. The tests I run are looking for physiology and physiological based function, not just pathology. And this is a key distinction. And this is what allows me to help people who couldn't previously be helped. Our current medical approach is geared towards drug therapy and surgery. All the continuing education, all the research and articles that our traditionally trained doctors are getting are sponsored, funded, and written by pharmaceutical interests. Many of my patients have been everywhere from major hospitals to universities, and they've seen some of the top specialists. And with all the testing, they still don't really have an answer as to why they have this problem or what's causing it. The cause of the problem maybe not be identified, but they may have some medications that help relieve the symptoms, but no real answers. In the functional approach, we look at the whole person, not just the bowel itself. And in doing this, we not only help the IBS symptoms, but we can also help other things that may seem totally unrelated. So it's kind of a nice side effect about treating the person and getting you healthy, not just treating your main condition. So in the next part of this series, I'm going to discuss a little about some of the functional tests that I do that many doctors are not doing. So good talking with you today. This is Dr. Scott again, and I'll see you on the next part of the series.